October of 2018, Congressman Rogers pulled a roundtable together in Moorhead of all the healthcare providers in Eastern Kentucky, along with post-secondary education, all to talk about the workforce needs of the healthcare industry. At the same time that this was happening, the Kentucky State Chamber of Commerce, the Workforce Center, was launching talent pipeline management. So the convergence of those two things happening at the same time was very fortunate for the region.
Congressman Hal Rogers charged SOAR with advancing the efforts of the Eastern Kentucky Healthcare Collaborative that he convened. There were an enormous number of employment opportunities in the healthcare industry, and we needed to bring educators, training providers, and employers together to move these efforts forward. SOAR immediately reached out to EKCEP and the Kentucky Chamber Workforce Center as talent pipeline management was taking off in Kentucky for the first time. We convened the healthcare collaborative employers again for the first time in January of 2019 and began these efforts. The employer collaborative projected 2 years out, and they said that in the next 2 years, they were going to need 730 registered nurses. A huge part of talent pipeline management is the convening of the partners. So we began to convene with everyone at the table again, employers and educational partners that they'd identified as those trusted partners in the community who they typically are hiring their registered nurses from. We brought them together and started to have a very real conversation. What are those issues? What are the challenges that these students are facing in these programs? They can't make it through. What we've done now is not just convened the employers, the educators, SOAR and EKCEP, but we've looked for creative solutions to these problems. It's the collaborative effort that is truly what has moved these efforts forward and what is going to continue to do so.
There's been a lot of work going on for the last 2 years as we work with talent pipeline management and all the business and industry leaders in healthcare. So we're excited about what this process is teaching us as a Workforce Innovation Board about how we need to change our approach to making sure that people, one, enter that pipeline, but also get the support that they need to stay in the pipeline until they're finished.
As PMC continues to grow and add new services and expand the existing services that we have, it was critical to find a pipeline of talent of healthcare professionals, particularly in the registered nursing field. It has been really good to see all these moving parts coming together, from us in the healthcare industry to the institutes of higher education, which will be training these future employees, to EKCEP, which is our workforce agency, the Kentucky Chamber of Commerce, which is with the Talent Pipeline Management Group that gives us all the tools to put it all together, and then of course SOAR, which is the binding factor for it all. Bringing us together has allowed us to establish goals and responsibilities and objectives that we can now put into action.
You know, we all realized that we had the same need. We needed to break down the walls. We needed to work together to talk openly about, you know, what our concerns are, you know, looking at the region and the workforce that we had, how could we improve that and how could we grow that and who do we need to work with? So it was eye-opening when we all put our data together. We came up with over 730 needed registered nurses in our region by March of 2021. And one of the things that we realized right from the very beginning is that we needed to work with our educators. Our educators were actually our source to our pipeline for our workforce. But I think they learned very quickly that we were all there for the same reason. We spent a pretty good deal of time brainstorming with educators and just looking, you know, what are the opportunities, what are the barriers? If you don't have a great success rate and maybe passing your NCLEX, what can we do as employers to help those educators? You know, I think our partnership with with educators, with other healthcare employers, with SOAR, with EKCEP. I think we're all on the same track. You know, we're looking for pulling people in. We want people to stay here. We want people to know what opportunities they have here.
It is of great importance that we work with our citizens to help them enter that pipeline and come out the other end with a career waiting on them. We're excited to be working with all of these local employers with great jobs and our post-secondary institutions to meet this high demand training need that we have in the region.